Hello everyone, it's Melissa Sweet here, public health journalist. We're broadcasting live from Canberra. We're on Ngunnawal country and paying our respects to the traditional owners before we start this interview with Dr. Liz Hanna, who is the President of the Climate and Health Alliance. We're broadcasting from the Australian Health Care and Hospitals Association, the AHHA, which has just kindly hosted a roundtable meeting following the launch of the Climate Health Strategy this morning at Federal Parliament House. Now, Liz, can you just introduce yourself? Tell us a bit about who you are.
Okay, greetings. My name is Liz Hanna. I have background in public health. I've been researching climate change and human health specifically at ANU for the past 10 years or so. And I convened Australia's National Climate Change and Human Health Adaptation Research Network when that was part of NCARF. And most of my primary research is heat and the health effects of heat and what we can do in terms of adaptation. And the sad side of that, of course, is the looming health crisis that we are facing here in Australia, specifically from rising heat. And of course, I'm president of the Climate and Health Alliance, which is my role here today.
What is the Alliance for people who don't know?
The Alliance is a group of 28 or so key health groups that have come together who are basically very concerned about Australia's slow progress towards mitigation, our unpreparedness, and so we're very concerned about the health impacts that are unravelling from climate change. And we as a health sector, we're the ones that actually get to meet and try to treat and rectify some of the health problems that people face. So prevention is a very key part of our thinking, and hence the fact we're actually stepping forward, and we've offered to help governments, to work with governments to recognise that climate change is a really serious health threat. All countries are learning. It's a new problem for all of us, so no one's particularly sure exactly how to do this. We haven't been here before, and so we're all learning. So we've come here to help government to tell them that, okay, we're here, we're ready, and we've mapped out a framework that.
So can you show us the document just in front of you?
We'll be happy.
Now, that was launched at Federal Parliament House this morning. It was quite unusual for such a contentious issue as climate change that we had tripartisan support at the launch. Can you just paint a bit of a picture for viewers about who was at the launch and why that was significant?
Yes, we had, and this is a wonderful example of the fact of how serious people are taking this. So we had three major parties here. We had Senator Ken White, Minister Ken White, from the Liberal Party, Shadow Minister Catherine King, who's responsible for health for the Labor Party, and the Greens leader, Dr. Richard Di Natale, who's a public health physician himself. And all of them were consistent in their support for the strategy. And we have very deep support from the Greens because Richard is a medical practitioner, so he has very, very deep understanding and great commitment. And of course the Labor Party, Catherine King, again gave very strong commitment that they will be taking this forward. Yes, so this is strong support, so we're very happy.
And I guess in a sense the framework is an example of civic society stepping up where there has not been political leadership, because once upon a time you might have expected a federal health department, for example, to lead the development of such a framework, or the NHMRC. So can you explain why an organisation like AHHA had to take the leadership here?
Yes, well, that's a very salient point, thanks. So it's the absence of the progress as far as health was concerned in this country. Not every country is suffering the same problems in terms of climate being, such an ugly sore between the major parties and sort of like a political football. Whereas again, from health perspective, we are talking about survival of the species. So this is bigger than politics. Everybody needs to be on board here. So we couldn't sit by and let the years roll by when Australian policies were, leading forward and then pull back and lean forward and pull back and be like a political football. And the health sector is a very trusted voice in Australia. We're not politically motivated by this at all. We seriously just want some decent policies, and we want some government leadership. And in this framework, we outline a governance framework for this to come forward. And so it's everybody's role.
You gave a very strong presentation to the launch. It was quite a despairing picture that you painted, I guess, of a future impacts of climate upon our health. Would you like to recap some of the key points you made, particularly around the impact of heat? And you talked about, the tropics virtually being uninhabitable for significant periods of the year.
That's right. The rate that we're warming at the moment is truly alarming. What I outlined today is that we know, and we speak in terms of the average global temperature, which has been historically around about, last century was about 13.7. We know that we've warmed 1 degree, but that includes the oceans. And so the average global land temperature is 8.1 degrees. The average land temperature in Australia is about 22 or 23. So we're 15 degrees hotter than the global average. So we're that far ahead of the curve in terms of facing a warming climate. And what people tend not to understand is that there's an upper limit to how we can physically function in the heat. We have upper limits to our thermoregulation, and we can't spend our entire time in air conditioning. So this is a really major issue in Australia for heat. So what we've got with the continued warming, and a recent report was published just this week, highlighting particularly in the tropical areas, as to because they're already very, very hot, the extra degree of warming is pushing them that much closer. So they're expecting that by the turn of the century, 50% of the world's population are going to be living in areas, or they're currently living in areas which will be unlivable for a large proportion of the year. And even in Australia, the tropical part of Australia, a third of the year is going to be at temperatures that's going to be unlivable. And this is because of the high humidity and the temperature. So even though we know that the warming is strongest at the poles, well, if the temperature's cool, their bodies can cope with a little bit of extra warming. But when we're already that close, this is where it becomes really problematic. And a vast proportion of the world's population live in tropical areas.
What are some of the key recommendations from the framework?
Key part of the framework is to put a health lens through our climate policies. And so this includes mitigation, and mitigating our emissions basically to save human health and human lives. And there's other things that we need to do, and that's actually, we need to reconfigure a lot of our sort of the ways the society operates. We also need to build up the preparedness of the health sector, because again, when disasters fall, it's the health sector, the health and welfare sectors that have to go and mop up the fractured lives or the health problems. So we as a sector need to be beefed up so that we can be well trained. There's also an enormous amount of health education and health promotion that falls to the health sector to provide, because governments in the health sector can't do everything. People need to understand what their own risks are and to modify their lives and to take all the precautions that they need to do to protect themselves. So there's a lot to be done. It's sort of the health sector, it's the community sector, it's the emergency departments, it's the health training, it's getting the message out to the people, and so there's a hell of a lot that needs to be done.
One of the messages, I guess, out of today is we can't necessarily wait to rely on federal government leadership. That other parts of society, other sectors, local government, for example, can take this framework forward. So who would you like to, put the call out to now? What organisations, what sectors would you like to see stepping up and engaging with this framework?
Again, another wonderful point. Thanks, Melissa. The governments can only, we certainly need governments to do things, but it doesn't stop at government. And we're working with the health sector. So in the first instance, we've got this alliance of all the organisations who have signed on and endorsed this, but there's others that we'd like to come on board. And that's actually get together to help prepare Australia for what's coming down the track. It's going to take a long time to prepare and build this resilience, and so we're putting the call out to all our colleagues in the health and welfare sectors to to roll this through, to incorporate the framework and the strategies and the recommendations that we have in this wonderful document, to prepare themselves and to get the conversations going and to make sure that they're doing everything they can, and also getting the message to everybody in Australia that every decision they make really ought to be considering, okay, so what impact is this having on my livelihood and the future livelihoods of the children, and particularly we consider the the toddlers running around. If a toddler's it's going to be sort of 5 years old in 2020, well, they're going to be 55 in 2075. The world is going to be a very, very different place, and so your heart must go out to these toddlers who expect and deserve a happy life, much as we've had in the past. So this is everybody's business. Hence the fact we put out the call to everybody, to all the organisations and all individuals, to really embrace the fact that we need to get serious about climate change.
And one of the sort of messages I took away from the roundtable meeting this afternoon is that MPs are going to be facing an army of climate and health activists you're seeking to mobilise.
Yes. So we've got, on account of it's, as I said earlier, it's a new problem. So if people aren't living in this space all the time, then they're not entirely sure what it is that they really need to do, what their remit is, what their scope of action can be. And so what we're asking our members and the sort of the health sector is to provide that support to their politicians, to be their sort of mentor, their health and climate mentors, so that they can provide them the information to help them make the wise decisions. Because in the absence of the understanding, it's almost as if people are waiting for someone to do something, and of course we've decided that someone is us.
Okay, well that's a pretty good note to end on, I think. Is there anything else you'd like to add before we close?
My only thing is to reiterate the fact that this is a very serious issue, but the thing is we still have capacity to put the brakes on this. We have the science, the technology is available. It's just a matter of getting everybody on board, and by that we mean not only the politicians, but through people's professional lives, their recreational lives, their domestic lives, because it is everybody's business and we all have a responsibility.
Okay, thanks very much, Dr. Liz Hanna. And we heard today also we'll be able to read some articles from you coming out in the Medical Journal of Australia, a series of 3 articles.
Correct.
So we'll look forward to that. Thank you very much.
Okay.